We need to make sure that the frontline healthcare remains stable and resilient to future shocks, from capacity challenges to our aging population. That's why I'm joining my fellow premiers and renewing our call for the federal government to increase the Canada Health transfers by 5.2% per year and provide provinces with stable, long-term funding we need to build a frontline healthcare system ready for any future challenge. With the economic uncertainty we face as a country, we also need an approach that will protect jobs in the short term and our economy in the long term. History has shown at times of uncertainty, getting shovels in the ground on projects of national significance will keep Ontario and Canada working, which is why we are asking the federal government to come to the table and provide their fair share of 40% of funding for our historic, ambitious subway program for the GTA, and approve the outstanding 250 projects that Ontario has submitted through the Investing in Canada Infrastructure Program. By delivering the needed roads, bridges, broadband, and transit to every corner of this province, we can deliver stability, benefits, and jobs to communities across this province.
One of the first things we're doing is setting up separate assessment centers so that people who want to be tested to see if they have COVID-19 can go to these separate assessment centers. We have 6 that are set up, including one in Ottawa. Within the next several days, more will be established across the province very shortly. We want to make sure that that doesn't put extra pressure on hospital emergency departments. We're very fortunate in the sense that the vast majority of people who have tested positive have not needed to be admitted to hospital. They're at home in self-isolation and they're being assisted by the public health units. However, all hospitals have the ability to admit patients should they need to be admitted for COVID-19. They don't all need to be treated in negative pressure rooms. They can be treated in isolation in other parts of the hospital, and our plan includes the availability of spaces in all of Ontario's hospitals should the need arise.
How separate are they? Like, is this a room in a hospital, or is this a completely separate facility? How separate are these, and what will they look like?
It's a separate facility close to the hospital. So it's really meant to take the pressure off the hospital emergency departments and to keep the people who may have COVID-19 separate from the general hospital population, because you don't want it to be spreading there. So as I indicated before, we have 6 that are ready to open within the next few days, with more to open next week as well. We know that it's important to ramp that up. We're also looking at, we've expanded some of the OHIP codes for physicians as well, so that they can do consultations over the phone to speak with patients to determine whether they need to go in for testing or not. So we want to take the pressure away from the hospitals as much as possible, and so that if people do need to be self-isolated, it makes it easier for them to be able to do that.